Oh, hello everyone. I'm Annalee Coakley. I'm the physician lead of the Mosaic Refugee Health Clinic, and I was asked to speak to you today about refugee mental health. And so it's a broad topic, and really to understand refugee mental health, you need to understand first who refugees are. So I thought we'd first start by talking about refugees, who they are, how they come to Canada, and what happens to them after they arrive in their new country for resettlement. So first, refugees, who are they? So refugees are people who have been forced to flee their home due to persecution for whatever reason. So it could be political affiliation, sexual orientation, their ethnic group, etc. So they're people who are forced to flee their home due to persecution for whatever reason. And so they have fled their home country, and they usually flee into a neighboring host country. So for example, if you were Somalian, you're then forced to flee because of ethnic tribal conflicts, Somalia, and you flee into Kenya for protection. And so usually in the host country, refugees either stay in refugee camp or refugee camp-like conditions. So they might be living in areas that are resource poor, often slums in the host country. And so in the host country, refugees will apply to the UNHCR for refugee status. And so they have a hearing with the UNHCR, and their claim is assessed, and then they're either granted refugee status, meaning they are determined to be a person in need of protection. And then the UNHCR, once that status is granted, will be responsible for providing for their basic needs, so food, water, shelter. And the UNHCR will also look to providing a permanent solution for them. That permanent solution may take the form of integration into the host country. It might take the form of repatriation to the home country. For example, if the situation changes in the host country, they might be able to return. And then the last option is resettlement in a third country, and that's by far the minority of people who are refugees in the world are resettled into a safe third country, such as Canada. So Canada, as a signatory to the UN Convention for Refugees, has agreed to take a certain number of refugees every year. And so refugees to Canada can come to Canada through two routes or two programs. So either they are government-sponsored refugees or they are privately sponsored refugees. So government-sponsored refugees are refugees who are chosen by the government of Canada for resettlement in Canada. And so the federal government will provide support for 1 year as they transition to their life in Canada. With private sponsorship, refugees can be sponsored by any group of 5 in Canada, and it's a situation that's quite unique to Canada in the world. And so any group of 5 can get together to sponsor a refugee or a refugee family for resettlement in Canada. There's also a third option, but it's by far the minority of refugees coming to Canada, which is called the BVOR. This BVOR is the Blended Visa Office Referral Program, and this is basically the government and a private sponsorship group going half-seas. So the government will provide support for 6 months, and the private sponsor will provide support for 6 months. So when the Government of Canada chooses refugees for resettlement to Canada, the Canadian government prioritizes the most vulnerable. So the Canadian government defines vulnerability as women and children at risk, people with high medical needs, and as well as survivors of torture. So already you can tell that those chosen for resettlement with the refugee program are those at highest risk of developing mental health challenges in the future. And so when refugees first come to Canada, this is where I meet them. So CCIS, or the Calgary Catholic Immigration Society, is the agency with the contract with the federal government to resettle government-sponsored refugees. As well, CCIS is involved with most privately sponsored refugees as well. And so following their arrival in Calgary, CCIS refers newly arrived refugees to the Refugee Clinic. At the Refugee Clinic, we provide comprehensive primary care for their first 2 years in Calgary. At the end of 2 years, this is where we transition them to their permanent medical home. When patients first come to our clinic, we do a comprehensive health intake. So we do an intake history, physical, we order all of the appropriate screening tests at that time, and then we follow them up over their first 2 years. We identify and address any chronic health issues that they have, identify and address any acute health concerns that they might have. We engage patients in preventative care, as well as we try to address any mental health challenges that might arise over their first 2 years. As part of the Refugee Clinic, we certainly have a large team that includes family physicians, various specialists, including psychiatrists, obstetricians, gynecologists, internal medicine specialists, and pediatricians. We also have a large multidisciplinary team that includes social workers, psychologists, patient navigators, dietitian, and chronic disease nurses who really act as complex case managers. One question I get a lot is, why do refugees need a specialized refugee clinic? It's not something that all newcomers to Canada are offered. Why are refugees special? And so the answer to that is that refugees are very different than most of our newcomers. Most of our newcomers are economic immigrants. Economic immigrants are chosen to come to Canada via a point system. And so the economic immigrant has to apply to come to Canada. So they're coming to Canada with intention, as opposed to refugees, where it was never their intention to come to Canada. And so economic immigrants apply through our point system, where the Canadian government requires that they have education and skills that the Canadian economy requires. They must have a certain level of English language proficiency. They have to be healthy. So unhealthy applicants are denied entry to Canada. And they have to have money in the bank. And so they're quite different. They have quite different characteristics than refugees. So as you can imagine, refugees have fled their home country and are often living in a refugee camp for many years prior to coming to Canada. So often their education has been interrupted, and so they don't have the level of education, they don't have the skill set that the Canadian government requires of economic immigrants. They've also never intended on coming to Canada, so they've not really looked into Canadian culture, the way of life in Canada. They've not studied English, and so they're often lacking in English language skills. And certainly because of their life situation and the inability to have made money. They often come without any savings whatsoever. The other main difference, which we touched on, is the Canadian government actually chooses those with high medical needs, as opposed to economic immigrants, where if they're thought to have high medical needs, they're excluded from coming to Canada. And so because of their lack of English language proficiency, the fact that they've been living in refugee camps where their opportunities to have education and employment skills have been curtailed, they often face numerous barriers when they arrive in Canada. And so in the past, when refugees had arrived in Canada, they were often suffering from numerous health issues, and they were ending up in the acute care site because they simply didn't know where to go or what to do. And so back 15 years ago, a resident in public health was taking notice that the Sudanese were accessing acute care services for issues that could have been better managed in the community through primary care. And so that public health resident started to attend the Margaret Chisholm Resettlement Center to see newly arrived refugees, to do an intake history, physical exam, screening tests, and address any acute or chronic illnesses that they might have. This program over the years has grown to become the program that we have today, which is quite large and comprehensive. And the reason for our comprehensive program is to help patients address any of those barriers that they might face when they're trying to access the mainstream health system. And so our whole goal is to set a healthy foundation for them upon which they could build their new life in Canada. Our goal is really to set them up on a path of success so that they can thrive in Canada. In terms of the barriers and resettlement issues that many of our refugees face when they first arrive in Calgary, I like to divide them into three different components. So one has to do with the intrinsic needs. So their need for safety, for stable housing, for financial security, for food security, and their need for educational and employment opportunities. The second category would be navigation barriers that many of our newcomers face. So those would be language barrier, because they often don't speak English. They often find it very difficult to access mainstream health services, as well as any type of service, any sort of social service. The other issue that they often face is challenges with navigation, so navigating the physical environment. So most of our patients need to utilize public transit, and it's often challenging for people to learn, especially given the language barrier. Often too, a lot of our health services do not exist on a C-train line. So luckily the Peter Lougheed Hospital is on C-train and is fairly easy for patients to access, but as soon as they have to access the Children's Hospital or Foothills Hospital, it becomes very challenging because it requires C-train plus transfer over to a bus, and most of our patients find it incredibly challenging to navigate to get to the hospital, and then once they're at the hospital, they find it incredibly difficult to navigate the building or the very complex set of buildings at Foothills Hospital. The third category of barriers that people face are adaptation barriers or issues. So that would be things like being part of a racialized community and the racism that people face when they come to Canada. That's often a barrier that people face. Usually when I see patients when they first come to Canada, and even for their first year, people are incredibly hopeful for their future in Canada. But unfortunately, over their first 2 years, they do become disillusioned and disappointed because their expectations are often not fulfilled. So many people think that coming to Canada is the land of milk and honey, and they'll be provided for, and they will have a stable and secure future for themselves and their children. However, once they come to Canada, they soon realize that living in poverty in Canada is quite challenging. And then they become disillusioned and disappointed and often frustrated. The other issue that people face is the issue of family separation. So oftentimes people have been resettled in Canada and they've lost their natural sources of support, which often involves family members, and they might have the expectation that they'll be able to bring their family members to Canada in the future. But then they soon realize that that's actually often not a possibility, and then they become disillusioned and depressed with the prospect of never seeing their family again, or at least not for many years. And finally, the cultural adaptation is often challenging. So patients also often struggle with how do they maintain their culture and adapt at the same time to this new culture, this new way of life that they've found themselves in. And so all of those things together, if not addressed, can lead to poor mental health outcomes. And so this is the work that both you and I do. So a lot of the addressing those various barriers, all of us have a part to play in mitigating those barriers in order to help improve mental health outcomes in the future for our clients and patients. And so in terms of the intrinsic needs, whether that's educational and employment opportunities, income, support and stability, stable housing and food security, I know that our clinic social workers, resettlement workers through CCIS and Center for Newcomers, as well as others, work very hard to address these basic needs. Of course, in order to meet some of those intrinsic needs, patients often need help navigating both the physical environment as well as our complex social and health systems. And people need help overcoming the language barrier in order to access the services, the supports that they need in order to have those basic needs met. And that's where social workers, patient navigators, resettlement workers are crucial. And most recently, Center for Newcomers had that lovely program with Uber, which helped provide our newcomers with access to transportation to help them overcome that barrier. And we've seen what a positive impact that's had on our patients. It's been easier for them to access the care and the services that they need by being able to provide them with transportation. In addition, having a resettlement worker teach them how to use public transit, for example, to empower people to be able to navigate the system themselves, has been critical. in improving both their health and mental health outcomes. And by helping people to adapt to the new society, and also by having programs that help fight racism and stigma in our society, that helps our newcomers, especially those from racialized communities. It helps them feel more welcome and safe in their new home. In terms of refugee mental health, they often most refugees have trauma in their background, but that doesn't necessarily mean they're going to go on to develop mental health issues or mental illness like PTSD or depression or anxiety. And we can reduce the risk of them developing mental illness or mental health challenges by being a welcoming community. And how do we become that welcoming community? It's by welcoming patients or newcomers into our society and helping them overcome these barriers that they face. It's when we are not a welcoming society and not giving a hand up to our most vulnerable newcomers, it's then that they will go on over the course of several years to develop mental health challenges, mental illness. My point is simply that many of those mental health challenges can be avoided, and it can be avoided by putting in the work up front. So if we create more robust services, and if we can become a more welcoming society to our newly arrived refugees, that will go a long way in mitigating mental health problems down the road. And my colleague, Dr. Courtney, will be talking about what happens specifically, or what can happen when we're not a welcoming society and patients go on to develop mental illness in their resettlement and settlement journey in Canada. Thank you.